Let's talk about superior canal dehiscence. My name's Amy. I'm a vestibular physical therapist, which means I treat dizziness and balance problems for a living and conditions like superior canal dehiscence. Superior Calan Dehiscence Syndrome is also known as SCDS. SCDS is caused by a thinning of the bone that encapsulates the inner ear canals. So if we dive inside of a human ear, first thing we hit is an eardrum. Behind the eardrum is a little space, which is known as the middle ear, and it connects the rest of your sinus cavities up through the eustachian tube. Behind that is shaved into bone here, but this part is usually just your skull bone. And if you open that up, you'll see that your semicircular canals and your cochlea, which is your inner ear, lie inside of that bone. And there's one little loop that sticks up right here on top. That's called the superior canal. So if we switch models, we now have what we can see as the temporal bone behind the ear as right here. If someone has a thinning of this spot, it actually causes that superior canal to now become open. Because the superior canal, as well as all the other semicircular canal, are fluid-filled vessels that feel motion by moving fluid in the inner ear, you will have issues with feeling motion if you have semicircular canal dehiscence. You will also have issues with your hearing because you'll have problems with fluid regulation inside this entire organ, including the cochlea and the semicircular canals. Aside from general problems with your hearing, balance, and equilibrium, you will also have something called autophony if you have superior canal dehiscence. Autophony means hearing sounds within yourself. So you will hear things about your own body that other people can't hear. Things like joints moving, things like fluid swishing, things like your heartbeat or your ability to chew food. You will hear those internally and you will hear them as amplified. You might also have something called hyperacusis, which means you are extra sensitive to sounds that don't bother other people. And those sounds might also trip you into feeling dizzy or off balance. Diagnosis for this condition is kind of tricky because even in a CT scan, which is the recommended form of imaging, it's sometimes hard to see that specific spot and whether it is open. Diagnosis also involves your symptom history, VNG testing, and hearing testing. Treatments recommended for management of this condition is usually conservative initially to see if you can manage your condition without any kind of invasive surgeries. Conservative treatments for this condition involves medications to help soothe the brain's reaction to these kinds of stimuli from the ear, management of fluid regulation between the inner ear and the rest of the lymphatic system using things like medications and diet. For those with hearing loss, sometimes a hearing aid can help with the regulation of symptoms through an audiologist. And of course, vestibular physical therapy, which will help you with your balance and your equilibrium. Conservative measures fail, surgery can be recommended if you're a candidate. However, because of where they have to get to patch this, it's very invasive and it can be risky. If you feel like you have symptoms of superior canal dehiscence syndrome, you can find a specialist near you who treats and diagnoses these disorders at vestibular.org.